So basically there's, as I've mentioned, there's lots of different lenses on the market. When you're starting to look at getting rid of reading glasses, you're looking at multifocal intraocular lenses. So these are lenses that, as the name suggests, correct for multiple distances. So correct for distance, intermediate or computer vision, and near iPhone vision. Traditionally, these are split into two classes. So there's extended depth of focus lenses. So these lenses are very good for correcting for distance and computer, and they will give you some near vision if you kind of perform a mini monovision setup. So, if you make your dominant eye, it's actually very similar to presbyon like we spoke about. So you give your dominant eye more of a distance focus and your non-dominant eye more of a near focus. So these still give my patients extremely good range of vision. They usually give functional near vision similar to presbyon. So iPhone, they do not give very minute detail. So if you want to look at threading a needle through an eyelet, unlikely, but they give very good like restaurant menus, back of medicine bottles, things like that. Usually I find that they give around kind of the J3 to J5 near vision. So it's pretty good. And the benefit of these is that they're very robust lenses. The optics aren't too complex, which is a good thing. So later on in life, if you go on to develop glaucoma or macular degeneration, they're usually highly tolerated. So I like them because they're kind of future-proofed. It's one thing putting a lens in a 59-year-old who doesn't have any eye problems, but then in 15 years, if they go on to have eye problems, you still want a lens that will be able to stand the test of time. And they also have minimal side effects. So some of the side effects of multifocal lenses are glare and halos. So glare is usually when you look at a street lamp, you might get like a halo or ring, and you might get kind of increased starbursts or those kind of visual aberrations. So they don't have none, but they usually have less. And I'm finding that each generation of extended depth of focus lens, I'm using the Pure C extended depth of focus from Johnson & Johnson predominantly at the moment, and I find that there's very minimal side effects. Usually patients get them for the first few weeks and then they go away as they neuroadapt. Right. So that's your extended depth of focus, and I usually put that in the middle. And then you've got trifocal lenses. So these are also multifocal lenses. These truly correct for distance, intermediate, and near without having to do any monovision setup or mini monovision setup. So both eyes will have distance, intermediate, and near. We're not looking at dominance and all of that like we are with presbyon and the extended depth of focus. These give much, I think generally they give a finer near vision, so you can see smaller things. But I do find sometimes there is a slight compromise in the distance vision with some of the lenses. So patients still get extremely good distance vision, but sometimes they say it's not as clear as it was in their glasses. And this is because the optics is quite complex with these lenses, as you can imagine. So, lots of them have rings. There's lots of different types. I use the Galaxy as well, which is from Raynard. It's got this spiral optical arrangement. There's lots of different ones. So upside is that you might get a slightly larger range of vision and maybe slightly better near vision. Downsides are you're more likely to get some glare and halos. Even the later models like the Galaxy, you still get a little bit of glare and halos. It's much better than previous models, but there's still some. And if you do develop other issues later in life, it may not be as future-proof. So you might never, but if you get really bad glaucoma when you're 85, it might not be as forgiving as an extended depth of focus lens. So you can see that it's quite complex. There's pros and cons to both. And again, it comes down to like what my patients want, what they're after. So if someone tells me they want to see extremely fine near vision, then you might think trifocal. But then if someone tells me they'd be really bothered by glare and halos at night, you'd probably err away from the trifocals. So, things that are important, are they a night driver? Are they a truck driver that drives all night? Are they seamstress? Like you have to get a lot of information about their daily tasks and what their visual goals are. But basically, both lens categories that fall under multifocals are great. They have pros and cons, and they can be very effective when you select the right patient. And I think patient selection is critical, and you don't always get it right. And patients also have to have realistic expectations, which as the doctor, we need to obviously give them realistic expectations. So there's never any 100% guarantees with any of these lenses of being completely glasses free. A lot of the time we get that, but like anything, there's no 100% guarantees. So you have to make sure patients are aware of that. And there's obviously risks of the surgery itself. Whilst they're low, it's still eye surgery. So that all needs to be really reinforced with the patients. But overall, this is amazing surgery.
So this might be also a good point to ask about cost, because I think you've described various types of lenses, and I think some of those would maybe come under the category of premium lenses.
So extended depth of focus and trifocals, which are multifocal, are both premium. Like that's premium. That's all under the premium lens category. So if you have a procedure, a cataract surgery done in the public system in New South Wales, you don't have access to any of these lenses as a general rule of thumb. So you only have access to what's called a monofocal lens. So that's a lens that just corrects for one distance, whether that's distance or near. For the majority of people, it's distance. So they get correction for distance, and then you wear glasses for reading and computer. So that's the most simple lens. That's not a premium lens. It's just a monofocal lens. And then the premium lenses, as I've described, the extended depth of focus like the Pure C, and the trifocal like the Galaxy. And then there's obviously different options that I use depending on different patients. I think one thing that's important to realize as well when you're talking about costs is with cataract surgery, a lot of, if you have private health insurance, a lot of the lenses are covered through that. And then also Medicare covers some of the procedure. So if it's a cataract surgery, whilst you're still going to be out of pocket for some money, it's generally a lot less expensive than clear lens extraction or in ICL surgery, because both of those procedures are considered purely elective. So that's kind of in the category of presbyond and laser eye surgery. That's more elective, trying to get it purely out of glasses. So there's no Medicare coverage, and health funds don't cover that generally either. Whereas cataract surgery is kind of financially, you're in a different category because private healthcare and Medicare cover components of the surgery. So it's just important for patients to be aware of that as well.
I'm not sure if there's any like differences between different states, like, Queensland.
Yeah, no, I'm just purely talking about our practices, our two practices in Sydney. Patients should definitely speak to their own private healthcare providers and their own ophthalmologists if they're interstate. But yeah, this is just from my perspective in New South Wales. With the premium lenses as well, we touched on, the multifocal lenses, but I didn't actually mention toric lenses. So these are lenses that correct for astigmatism, because I get a lot of patients asking me, can I fix their astigmatism? So the answer is yes. We can fix astigmatism extremely well with modern lens technology. And so the premium lenses, or these multifocal lenses, have toric range. So you can have those special lenses, but also correcting for your astigmatism based on calculations. So we can have what's called toric premium lenses as well.